Coming up on today's show, we are bringing you your weekly COVID-19 updates and how it's impacting your mental health. Hello, darlings, and welcome to your weekly COVID-19 update. I am your host, Portia Scott, and as always, I am joined with our resident experts. But before I bring those on, let's get to it. Val, thank you so much for joining, darling. John is on. Thank you guys so much for joining. So where are you staying at home at? Where are you watching from? We want to know. Let us know in the comments. Are you watching from Boston? Are you watching from Atlanta, California? Where are you? We have people that watch all over the globe. So we want to know where you're watching from. Let us send you a shout out. One of the things that we love to do here is we want to stay in touch with you. And the way that we do that is through text. So if you text the phrase wake up to 31996, that's wake up to 31996, you will be in the know whenever we do our daily show as well as our weekly shows. And we also love to send you some inspiration and encouragement throughout the week. So that's wake up to 31996. Listen, one of the things we love to do around here, we always say this: you may not be able to feed the 5,000, but guess what? You can impact one. And until you can feed the 5,000, let's do our part and impact one person, one donation, one help at a time, one act of kindness at a time. And so this week, as well as last week, we were looking at Family Promise, which is an organization that helps find homes for homeless families, specifically women and children, especially during COVID-19. They are doing tons of work to help relieve families that are displaced. And so let's go ahead, let's make those donations, look into Family Promise and help somebody today. That is your act of kindness. Listen, we have literally been doing this for over 8 weeks. Can you believe it? It has been 8 weeks and you guys have been an amazing community. We are so happy to have you. One of the things that we want to be able to serve you even more, we want to make sure we're bringing you content that you love. And the way that we can do that is if you take our survey. So if you look in the comments, there is a link to the Survey Monkey survey. It'll take you less than a minute to fill it out, but we want to hear from you. So go over there, fill out the survey. This really gives us an opportunity to serve you in just a bigger and better capacity. Once we hear your feedback, we want your honest feedback. Let us know. So again, go in the links, go in the comments, click on that link and answer the survey today. Thank you so much. We have Brianna in the ATL. I believe that's Dr. Christie's daughter-in-law. Trish from California, thank you so much for joining, darling. Juanita from Maryland, thank you so much for joining, darling. You guys, come on in the room. We have people from all over. So listen, we want to bring on our resident experts today. I'm so excited because I'm not only joined, with myself, but I have two amazing co-hosts. And so I'm going to introduce our first co-host, who is Dr. Donovan Christie.
Hey.
Hey, Doc. Thank you so much for joining.
Awesome. It's always a pleasure to be here. The highlight of my week. It's a great way to start the week.
It's the highlight of my week too. I really, really look forward to it. So, Doc, we do this all the time. I'm going to bring Marty on and then we'll do our What Are You Grateful For? We'll all come in and have us in. So our next guest is our mental health professional, Marty Sellers.
Hey there. How are you? Happy Saturday. I'm a day behind. Y'all.
Happy Sunday. It's so funny. I feel like I'm like an announcer for like boxing. Like I'm like in the red corner is. So you guys know how we do it. You guys are big about this anyway, this positive thinking, positivity.
Right.
So Doc, what are you grateful for?
Well, this week, every week I try to be grateful for a different thing.
Yeah.
We have, in my office, I've hired postdoctoral students who have graduated from medical school, and they have a year in between before residency. And I actually hire these highly learned people as medical assistants.
Yeah.
So they actually work with an MD degree in my office. They're not licensed, but they're like glorified medical assistants, you can call it. And they've just been awesome. And this group that we had, they're leaving at the end of this month. So I just want to, give them a big shout out. And I'm very grateful for the work that they did this year. And, we were truly blessed with their presence and their skills this year.
You know what, Doc? I wanted to say, I'm going to miss them. Like it's so funny because we come to your office and people know us and it's almost like they become family, and I'm just going to miss them. I'm excited for what they're going to do, but going to miss them. So one of the things I wanted to tell you was that you saw somebody last week. Their family came in to do some testing. Your staff did. And one of the things she said was they were so kind. And they took care of us. And it's so important that, and so I just want to say that because I think it's important that it could be fine that the doctor is great, but if the staff isn't, and it just proved that your staff is exceptional. So just kudos to you guys at Anwan.
Yeah, for sure. We've been blessed.
Yeah. So Marty, what are you grateful for, my friend?
One, we're just grateful for that we have, I know I sound like a broken record. I'm just grateful for my family. I'm grateful for just being able to wake up every day and be healthy and strong. But I'm most grateful for that this message of mental health is really starting to resonate. And I am seeing Black men and brown men finally having conversations about their mental health. And they're not ashamed of it. And, they're almost like boasting now. Yeah. All right, man. Yeah. I got some problems. Yeah, we all have problems. But it's becoming a conversation that we don't have to hide behind or be ashamed of. And we can finally say, hey, I'm having some problems and it's okay.
Absolutely. I love that. I love that. You guys know what? I don't think I've said it on this show, but I'm so grateful for this show. And I'm so grateful for you guys because I don't know if people know, but the amount of time that you guys put in, I can only imagine what the billing would be. So I appreciate everything and people love it. And so the opportunity that I get to host this show with two amazing people, three amazing people. D. Mitch is the Mac in the back, who is our producer. And I'm just so grateful for you guys. So that's what I'm grateful for. You guys out there in the comments, let us know what you're grateful for. Juanita says, I am grateful that I can still work from home. Yes, so many people are. I know we have people, again, from Texas that are coming in. I saw a couple of people come in from different places. So you guys, we're going to get on with today's show. I am excited. I am always excited. We have some new content, some new questions to ask as always, but I think these are good. Doc, we're going to start off with what we always start off with. Let's start the numbers because this is the only place where I get the numbers from to keep my mental health.
You don't want to follow these numbers on a daily basis.
No, you don't.
Hourly basis. It certainly, we'll be needing some mental health with Marty for sure. But yeah, the numbers keep going up, and it's going to keep going up for the next few months. In terms of total number of cases, it's always going to go up because if you have one, it's still going to be more than it was yesterday. So, but the total cases in the U.S. is 1.4 million cases. 100 was 35,000. Yeah, I don't want to round it down, but it's 1,435,000 cases in the United States. This week we had an additional 23,000 cases, which is less. And the total deaths is up to 87,315. 87,000. And for this week, we had an additional 1,300 deaths. So if you remember when we went back before, we were having much higher numbers of new cases. So the new cases are, in fact, coming down overall, even though, you see that the amount of states are opening up. 48 states now or partially, or I don't think anybody's fully opened, but there's a couple of states that their numbers did go up, but I think for the most part you see a flattening
Okay.
of the cases. Yeah, so that's pretty much what we're dealing with.
Absolutely. Thanks, Doc. So
Mhm.
I think it's important to kind of note, some of us have been hearing in the news. And I think even when we still hear those numbers, like I know it's kind of, flattening and things like that, but you still see the cases going up, right? So there's still this anxiety kind of or concern about it. I will say that I have not been anywhere. I've been to church, but like I am still Instacarting. I am still targeting from my car. So, but I did say this. I did say that I was going to go to one place that wasn't busy, in and out, to try to manage that mentally. So, Marty, I know that wasn't on there, and we do talk about this a little bit, but what are kind of some of those things for people who are saying, I know it's flattening, but I'm kind of scared to go out? So, what are
Right.
some of those one-step things that we can do?
Of course, as you were saying that, I was thinking through this, and I love acronyms because that's just how I think. I'm not that smart, so I have to do things that's going to help me remember things. And I say, don't switch off your brain just because your state is partially opening up. Use wisdom, and I want to use the acronym of WISE. And when saying WISE, you got to do the things that are going to fit for you. And I say it this way: W is work through your emotions. Begin to work through your emotions and beware of the toxic thoughts that you might have. I is increase your own awareness of your triggers. So if going out is increasing your triggers, work through it and find out ways that's going to help you get to your level. And also in the eye of increasing your awareness, stay grounded as best as you can. Doc has been saying this week after week, and we have too. Do those things that's going to help you stay grounded. Exercise, meditate, yoga, prayer, whatever's going to help keep, and a combination of those two, keep you grounded. So that's increase your awareness of the stressors. S, set priorities. Give yourself your own priorities, and those are your personal goals and your family goals, because too often we allow other people to set our priorities, which can trigger our stressors and increase our anxiety. So set your own priorities with that. And finally, on the E, what I call evaluate and examine your own self by increasing your self-care in the E. With that. So in that, so use wisdom, be wise is what I want to say in all of that. Be wise and know yourself, what your limitations are with that, and don't overexert yourself. If you're not ready, it's okay that you're not ready. Take your time.
Absolutely. I love that. So, Doc, I wanted to ask you, we've been hearing a lot about just the kids and Kawasaki, and how this is like, I mean, it's a disease that's been around, but now it's kind of linked to, or all kind of stuff, right? So I don't even have the answers. As you can tell, I'm even confused. So can you help us understand exactly
Sure.
what is like this multi-system inflammatory thing that's going on?
Syndrome, yeah. Well, that Kawasaki disease has been around for a long, long time. I think since the 70s. And as I'm a pediatrician as well as an internist. So in residency, that was the last time that I actually saw a case of Kawasaki's. And what it is, it's a inflammatory condition that affects the medium-sized blood vessels. So it creates inflammation of the blood vessels. So kids will present with this very high fever for about 3 days or so, and then they'll get a conjunctivitis, which is the reddening around the eyes. Their lips, their tongue will get big and swollen, and they can get this inflammation can go into their coronary arteries and create aneurysms in the artery. I remember when I diagnosed it back in the 90s or late 80s when I was in residency, we would do an echocardiogram looking for aneurysm in a kid less than 5, because it typically occurred in children that were less than 5 years old. And, a lot of them, the treatment, they would give them anti-inflammatories. Aspirin was one of the big things that we used, as well as immunoglobulins intravenously for those sick kids. But, what they're seeing at this point is in New York City in particular, poor New York, that's where I lived for 30 years. So it's amazing how, this virus, we know that this virus produces this cytokine storm, right, which is an inflammatory storm. So it's creating inflammation in the blood vessels. So it's kind of like a coronavirus-induced Kawasaki disease. So now they're saying, well, okay, kids are not safe because in New York alone, there's 120 cases, confirmed cases of this multiple inflammation syndrome that's in children. The difference is that it's affecting kids from the ages of 2 all the way up to 15. This is not limited to kids that are less than 5. So we have this inflammatory reaction from the virus that's creating a Kawasaki-like syndrome in these children.
Wow. So, wow.
Mm-hmm. So a lot of things have, you have to think about, well, can they really open schools now in August or September? I was watching the governor, Cuomo in New York. He was talking about it, and the reporters were coming at him, and he was like, well, nobody knows anything. He says people can guesstimate, but no one really knows what exactly is going to happen in the future. We just have to live each day with positivity. Don't just think of negative. Oh, well, we're all gonna die. I mean,
yeah.
You can't live that way.
So, Doc, I had a question because somebody said, "What are the signs to look for in our children?" I definitely have 2 that are over 5, but like you said, it's kind of spanning that. So, what are some of these symptoms to look for?
Well, for sure, fever. Which is, we know that with coronavirus, fever is one of those paramount symptoms that you'll see. So fever, and they should have high fever if this is a Kawasaki-like. It should be 103, 104, 105, and they should have it for several days. So fever, cough, definitely a conjunctivitis, which is the redness around the eye. That is a key symptom that we look for. And then if their tongue starts to get swollen and red, looking like a strawberry, then that's another sign. But cough, the same type of symptoms that you would get with a typical upper respiratory, but the big change is the fact that the temperature is so high, and then the conjunctivitis and so on. So those are the things that you look for.
Got it.
Wow.
Yeah.
Mm-hmm.
And so I've only seen the cases. We've only kind of heard of it in New York, and probably because that's where the cases were, where I think the children passed away. Are there other areas where we've seen this?
Yeah, there's several states. 8 states have reported, and Europe have reported this Kawasaki-like syndrome. Yeah, so it's now that they're reflecting, they're going back, right? And they say, oh, okay, well, why all of a sudden we have a higher incident? Because this is a rare condition. It's not common. So when you start seeing it, you're like, okay, well, this is related. And all these kids that are coming out with it have been positive for COVID-19.
Wow.
Got it.
Yeah. So there's been 2 deaths in New York. 1 2-year-old and 1 5-year-old from this condition.
Okay. And so what is some of the, I guess, the treatments that they are doing for those children that come in presenting?
There's still no approved treatment for COVID-19. The remdesivir is the antiviral that you can use for emergency use if you want to treat the virus. But with this inflammatory condition, it's really not the virus you're treating the inflammation. So they're using high dose aspirin. And aspirin is an excellent anti-inflammatory, but it works particularly well in this condition. And then they're using pooled gamma globulin. Let me explain. Those are antibodies that are pooled from a variety of people, obviously sterilized, and then infused. So these antibodies then go in and they kind of bind up a lot of the inflammatory mediators and get rid of it. And yeah, I remember even the case that I had as a resident back in the early 90s.
Yeah.
That child lived and went on and lived a normal life.
Wow.
Yeah.
Mhm.
And so is this in a normal condition, a child that gets Kawasaki's, is there treatment for the Kawasaki's? But because it's kind of related to COVID, there's no treatment. Is that correct? Or
Well, no, I think you would treat it, they're treating it as though it's a combination of the two. So they will treat them with an antiviral, and they'll treat the inflammation as well.
Okay, got
I
it.
mean, you remember, let's say there's 200 kids, 2 kids have died. That's less than, they're treating them.
Right.
Okay. So,
Got it. So while we're on kids, Marty, kind of coming back to you,
Yes.
We try to keep our children away from the news. And even if you're keeping them away from the news, I know I keep my kids away, but they still know that they're home.
Yes.
They still know the situations. And so
Yes.
what are some of those signs to look for in my kids that they're stressed, that they're, maybe not doing as well, mentally? What are some of those signs? Because with adults is kind of easy, but I feel like kids, because they don't have language per se for how they feel, what are some of those signs?
Yeah, some of the signs that we definitely see is definitely some reverting back to as kids develop. We like to do developmental stages and milestones. If you see some of your children returning back to some of the milestones, I have a 4-year-old and she's having these little accidents. And at first, I had to remind myself, okay, she's used to being at school. And so I now have to remind her, baby, let's go to the bathroom, let's go to the potty every hour, and these type of things. And if they're doing a lot of whining, or even their stomach hurts, or they're having headaches, or those type of things, because a lot of times stress and anxiety does, and Doc's been saying this, I love it, has a direct effect on us physiologically as well. Our heart, our stomach, our immune system, all of those things. And so for children, it could be their stomach aches, or that they maybe are having diarrhea or constipation or something. All these things, because those are just your nerves affecting all areas of that. So I'm so glad that we have a doctor on here to confirm these things as well. Irritation, anxiety, jumping all over the place. Maybe their energy level has gone up. And now, especially our children that we have labeled ADHD and all that, there's nothing wrong with that. We have to just redirect all of that wonderful energy with that as well. And let's have aged appropriate conversations with them to let them know that they're okay. Yes, things are changing. Yes, mommy and or daddy, or we're home and things look a little different, and we're all in this together, and they don't have to worry that you are there to support them. Children just need to know that they are heard and that they are supported.
Excellent. Thank you so much, Marty. One of the things too we've been talking about is just kind of like sliding scales and getting help and things like that. And so just wanting to make sure, because this may be something people never thought about, getting their child some help. So does it work the same way just with children?
Yes. Yeah, we have several children that we have, and the kids are already used to doing Zoom and everything. Speaking of children, as she comes in, hi Tony.
Hello, sweetheart.
Hi. Oh yes, giving them attention and time. We have on our ballerina dress.
Oh, beautiful, beautiful.
Giving them some extra time, but it does. Okay, we have paper right here, sweetie. But what happens is they're used to Zoom because their schools are doing it. Her daycare sends a YouTube link every day, so we have that we look at. You're very well. So that's happened. So yes, doing child therapy via Zoom and these type of things, it works.
Absolutely. So I love it. I love it.
Portia,
it's real life.
You have the co-host there.
I know we got I have three co-hosts now. Love it. Love it. Doc, one of the things I want to talk about is that, I went to go get my test and we're negative, right? But what happens if I'm positive? And especially what happens if I come in and I don't really have any symptoms and I'm positive, right? What are some of those things that we need to really think about if I test positive?
Yeah, I know, because, just because you test positive don't mean that you're going to get a fulminant pneumonia and get hospitalized and be put on a ventilator and all of that, right? Because 98% of people can be managed really in the outpatient setting. So what exactly should you do should you get a positive test? First, you want to pray that I say that jokingly, but praying is good. You should always pray. But there's certain things that you should do, because we've had quite a few positive cases, and we don't admit. We have only one of my patients was admitted to the hospital, and she was an elderly woman in her 80s, and she did well. She was in there for 3-4 days. She didn't get a ventilator. She got a little bit of oxygen, and she came back out. I saw her in the office like a week or two later, and she's doing just fine. But if you do get a positive test, say you do a drive-by and they tell, well, you're positive. These are the things that the CDC recommends that you should do. First, you want to stay home. The only time you should be going out is to seek medical care. And the only time you should be seeking additional medical care is if you develop symptoms of shortness of breath or high fever and you feel really, really sick. You have to be really sick to really want to go to the hospital. First thing, you want to stay home. You want to go into isolation. You want to separate yourself, because I'm sure you're going to have, if you have family members there, you want to separate yourself from your family members and animals. They actually recommend you separate from your pets as well. You don't want to be breathing on them. And then if you you should use a separate bathroom if you have one. If not, then you just have to make sure it's wiped down, between use. With the surfaces should be wiped down with a good disinfectant. You should wash your hands and have the right hygiene. And should you go out, you should wear a mask. If you're going out with your family members to do something, you should have a mask on in the car. If you're going to be in the same room with them, you should have a mask on. So basically, it's kind of an isolation, but if you have to be around people, you should have a mask on. Okay?
Okay.
What else?
I thought you were asking me, because I had some questions.
No, I'm asking myself. So what else? So the appropriate hygiene is important. I talk about washing your hands with soap and water for at least 20 seconds.
Yeah.
You want to avoid sharing household items, such as glasses, cups, eating utensils, towels, bedding, dishes. You pretty much have to just kind of make sure that those things are clean between use. You don't want to share it. So, I'm the kind of person, I love to share my food when I'm eating. I'm like, hey, taste this. You can't do that. My wife is like, are you always pushing food on me? But I do that. So, and then monitoring your symptoms is very important. So you want to monitor for difficulty breathing. And if that becomes an issue, then that's when you should definitely seek additional care. But for the most part, you can stay home, take your vitamin C, take your vitamin D, take your zinc, get a good multivitamin, and get rest, drink plenty of fluids. If you have a fever, take stuff for that. And that's it, and 98% of you are going to do just fine.
Absolutely. So, Doc, go ahead, Marty.
I'll say, Doc, I would love for you to speak to, because out here in California, in the county I'm in, you can choose or whether or not to wear a mask. And it drove me crazy. I was out and I was out, had my mask on, And I'm seeing parents have their little ones out with no mask. And I'm like, stop it. Get them, get them home. Two, put a mask on them. Can you remind people the importance of the mask and why we're even suggesting the mask?
Yeah, well, the mask is going to protect you, and it's going to protect the person also wearing the mask. So it's a double protection. So, I mean, we went to the store, Jackie and I went to the farmer's market to pick up some fresh produce. And I will tell you that only about half the people had masks on. We obviously had our mask on. We don't go out in public shopping unless we're wearing our mask. And obviously, I don't see patients unless they have a mask. If they don't have a mask, we give them one. Because I'm not going to go in the room and examine you and you just, well, I just don't want to have a mask. So we kind of mandate that they have to wear it when they come in. And definitely if they have symptoms, respiratory symptoms, you should wear a mask. Some people are against wearing a mask. They just don't want to wear it. They say, well, I'm not symptomatic, and so I don't feel like I need to wear it. I said, well, you're protecting, you're not protecting me. Who's taking care of you. So you really need to wear a mask. I said, well, doc, if you want me to put it on, okay, I'll wear it. And so I said, well, please put it on. And, 100% of them will comply to that. But some folks just don't want it. It's important. You're protecting yourself and you're protecting others.
I agree.
Absolutely.
Thank
I
you.
love that. Yeah, I love that. So 2 questions we have. One is from Val. She says her hairdresser is doing hair from her home. You have to remove your shoes before going in and masks are required. Do you feel it's safe to go into other people's homes for services like this?
Well, I can tell you that it's been happening all over the country. And the number one thing is that if you screen your clients, say I'm the hairdresser, and if I'm screening my clients appropriately, and I'm making sure that they don't have a fever, that they don't have any respiratory symptoms, you got to, we have a sign in, we're a doctor's office, and we tell people before they come in, and there's a sign on the door, if you have any symptoms of respiratory illness, you need to let us know so we can make sure that we're on our P's and Q's and we're wearing our proper personal protective equipment. But I think if you're going to do hair, it's perfectly fine if that person has no symptoms and they're wearing the mask. I just don't think that, you should go around for like 3 months without getting your hair done because you're afraid of that. I don't think it's a problem, but it really has to do with the person who's doing the hair. If this person has an autoimmune disease or is immunocompromised or have diabetes, does she really want to do that? If she's pretty healthy and have no comorbidities and she's going to wear a mask and she's going to have all her clients to wear a mask, the risk is lower. There's always a slight risk, but I think you have to manage risk. That's how it is. You just have to manage it.
I appreciate that. And probably taking temperatures, right, Doc? Like making sure, because I think people will say, no, I'm fine. I mean, how many people have you seen in the doctor's office that are like, no, nothing's wrong with me.
Right.
But I think taking those temperatures, there's a
and the ones they have now, the forehead ones, are so convenient. It's just 30 seconds, you can see, okay, 97.8, and you're good. I think that's something to invest in. If you are in the personal care industry like that, it's a good thing to buy.
Yeah. We're going to start.
Yes. Then we're doing that as well. Sorry, Portia.
No, that's fine. I was saying we're going to start that too. Once we start to integrate within the church and stuff like that, we'll still do a slow thing, but we're going to be like, what, one, because our pastor has, a system that's immunocompromised, but I keep telling him, I think you're fine. I think you're better than all of us because of the medications that's in you. But here in Atlanta, actually, they have a COVID conscious barbershop. And so when this started happening, they disinfect with all the stuff. They give the people pagers. You have to wait outside. So there's absolutely no waiting room. You have to take your temperature, get your mask. And it's very limited, the number of people that can be in. So some people are really, really taking this, and I don't know if that'll be the new norm, but I know somewhere like that would definitely make me feel, a little bit more comfortable because they're doing all of this stuff. So Doc, a couple things, because I don't want to miss these comments, Pamela. She said she wanted a reminder of the benefits of the antibodies test. So her local labs, they're now offering the lab. So she wants to understand the benefits of the antibody test.
Sure. And it gets a little confusing because people don't really know what tests to get. But the antibody test is good for people who have no symptoms, who just want to know if they've been exposed. And it's going to tell them if they have an antibody to the COVID-19 virus. In other words, the body, they did get an infection, but they didn't know it. And now they have an immunoglobulin or an antibody, same thing, immunoglobulin antibody, is the same word, that against the virus. That's what that test does. Now, if you're sick, you want to get the RNA PCR test, which is the nasal swab where they're checking for that viral particle itself, that RNA particle of the virus. That's going to tell you if you are acutely infected, if you're symptomatic. Now, I do want to talk about later on, let's say you did get a positive test, how long you have to wait before you do another test and which test you should do. So I will get into that. But that's the benefit of the antibody test, is to find out if you were exposed and now your body has mounted a response to it.
Okay. So, Doc, just to make sure, this test would tell me if I'm like asymptomatic, right? So if
Correct.
Okay.
Right. If you were asymptomatic. Now, it's also a good test if you were positive for the swab, and the CDC recommends you have to be asymptomatic for at least 10 days, and you shouldn't have a fever for at least 3 days. Then you can go ahead and do an antibody test to see, did you mount that response now? Because if you do another viral swab test, this is something that I just found out last week. That viral particles test is going to stay positive for weeks. So if you keep doing it and say, okay, do you want to go back? Can I go back to work? And you keep doing a swab test, it's going to come back positive, and so you'll never go back to work. So you can't use that test as a test to say, well, you were positive 2 weeks ago and now you're positive now, so you can't go back to work. You got to go based on symptoms. If they have no symptoms, even if the swab is positive, that's why they recommend, the CDC recommends don't even do another swab test. If you're going to do any test, do an antibody test.
Got it. So Doc, how much do the tests cost? Let's just, all of the tests. What is the cost for those tests? Let's do all the test? Yeah.
Okay, so the rapid test is it's $60 for the rapid test, and that's the IgG antibody test that I just talked about. That's the typical fee. Some people charge a little bit more. Some people may charge a little less. And so that's what that would be if you're asymptomatic. Now, if you are symptomatic and you have, symptoms of COVID and you do the nasal swab, that test is normally reimburses, I think, about $115 for that, and most insurances pays for it. The government also came up with this plan where if you want to treat people that don't have money for the test, that you can collect their name, enroll in this program as a practitioner, do the test, and bill Medicare for the test, because the government don't want you not testing someone because of the fact that they can't afford it. So essentially, uninsured or people without the money, the funds to get tested, should be able to get tested. And we just actually enrolled into that because we understand the reason, the benefits of doing the test. So we can do the swab test that way, and then we can bill Medicare for that particular test.
Excellent. So, Doc, we have another one kind of surrounding tests. I think tests are a big one today because I think a lot of states are either rolling it out or labs are doing them now. So what test does Dr. Christie's office conduct?
Which one do we do? We do all of them. The only one we don't do yet is the one that I talked about last week, the antigen test. That's the one that has an 85% sensitivity and the 15% falls negative. That one has not been released in Georgia yet, but we have the antibody test that you can find out your results in 30 minutes, which most of people have done. And then we have the swab test that we can send out to two different labs we're using, LabCorp and another lab called Capstone, and you can get that result within 24 to 48 hours.
Okay. And then does insurance cover the antibodies test?
Well, at this point, no, it does not. But there is one antibody test that is not rapid. We have the rapid antibody test, the 30-minute test that you can do, and the insurance will cover. But they don't test for both IgG and IgM. It only tests for the IgG, and insurance will cover that one.
Okay. And what's the cost for that, Doc? Do you know?
For the one that goes to the lab,
the one that insurance will cover.
Insurance will cover it. So
completely.
Yeah, they will cover it.
Oh, okay.
Yeah, people don't have to pay out of pocket for COVID unless they want to know immediately what's going on with the rapid test.
So the rapid test.
That's not covered. Yeah.
Okay.
I know here in California, if you go to the county websites, I'm signed up for about 3 different counties, and they give us a daily, the daily count of tests they do. Gets a little bit overwhelming, but it's good to know. But also they list on there all the places for those who don't have insurance where they give them do the test for free.
Free. Yeah. Yeah, they're doing that. And in private doctor's office, if they sign up for this program, they can also do the test for free, and the government has promised to reimburse us for it.
Excellent. So Trish wants to know, and I think you kind of answered it. It was the antigen test. And I think a lot of us are getting the antibody with the antigen test kind of mixed up. So it says, are these antibody tests more reliable now? Initially, they were given error in results.
Well, I mean, you're going to always have some false negatives and false positive in tests. There's no 100% test. The best test you'll get is about 99%, 98% sensitivity and specificity. Sensitivity is the ability for it to pick up that you have the disease, and the specificity tells you how specific it is. Is it just for this particular disease, or can it be a false positive because it's picking up something else? So you're going to have that. Now, I will tell you that Abbott Labs, they were the first one to come out with the rapid test. And that, I think that's the one that the White House personnel had used. And, they found out that some of those tests were 1 or 2 people got false negatives, and, they actually came down with it. But I think overall, the antibody test is the one that we have, I know, is 95 to 98% sensitive. That's what they have in their literature. And most of these tests have been approved for emergency use. So they have not undergone the rigorous FDA credentialing process that typically, but that takes years to do. So we don't have years. We don't even have months. We have to do something. So, just take it. If you get a negative and you really think something is going on, then get a more specific test. Get the nasal swab test. That's going to tell you if you have the disease.
Absolutely. Love that. I know Kim said her insurance does cover it. So that's excellent. Paula wants to know, she said it's time for her to go into the dentist. What safety measures should be in place in that type of close setting?
Well, unless you have a cavity, I probably wouldn't go to the dentist.
Unless it's like something serious.
Yeah, unless it's something serious. First of all, I just think it's so close because they're in your mouth for a period of time. And a dental cleaning, they always wear mask anyway, right? So it's no different. But as long as the person who's in your mouth has been tested negative, I've tested all my staff. I've recommended that my staff get tested, and we're going to be doing that at least once every couple of weeks, maybe once a month, just to make sure that the caregiver, the people who are providing the care, are not out there, spreading anything. So I think your dentist and his hygienist, Paula, they should be tested. If they're clear, then I think you can go in and get your elective procedure Um, Otherwise, make sure you're in pain when you get in there.
Right. Right. Doc, just because we're on the dentist, one of the things that, I'm pretty sure you've heard all the just different arguments, right, with staying at home. But then if we don't go out, we don't develop the antibodies or the bacteria that's out there. So we won't be able to fight off, our bodies won't be able to fight off all these things. And then kids getting immunized, especially as schools are coming back. So, say, for instance, my child needs their immunizations. Is it fine to go into doctor's offices then,
Oh yeah.
pediatric offices?
Oh yeah. The thing, most doctors' offices now are not seeing people that are sick with possibility of having
Mm,
COVID-19. They're screening those people outside. We have, just like people driving by and getting tests, we actually have our team will go out and swab those people. The people who are coming in the office are coming for their physicals, are
mhm.
coming for their vaccinations, are coming because they have an injury outside of COVID. Things still happen beside of COVID, so as long as we keep the COVID positive people out, it's safe. It's safe to go in and get your vaccines and to do what you feel like you need to do. Get your prescriptions refilled for your blood pressure, your diabetes. Don't let everything go by because of this. Because I know in our office, we welcome people who don't have COVID symptoms to come in and get their routine care.
Yeah. So I think it's important that, we always talk about taking care of our own health. And I think when it comes to that, I think it's perfectly fine to ask your caregiver or talk them on the phone and say, hey, I need to come in. But, is your staff safe? Like, has
Right.
your staff been tested?
Exactly.
And then kind of make that decision based upon that. And I don't think anyone would be offended. And if they are, it's probably not the right doctor's
Right.
office. That's
Right.
just me.
Right.
I would
I
agree.
think it's appropriate.
But as we're talking about children, Marty, and going back
Mhm.
to school, it's funny. I listened to the governor of California and even the mayor of LA, and just kind of talking about what going back to school may look like.
Yes.
And so one of the questions was, do you think it's important that schools kind of implement some sort of counseling or advisement as children start to go back to school after like COVID-19, and just some support for the kids?
Most definitely. And what we're seeing a trend out here, that's always the conundrum in that, we definitely need mental health in the school system. We know that. Now it's really getting the most effective version of mental health, because a lot of times when we say we have school counselors, they're
Mhm.
doing more academic counseling and not emotional counseling in that. So yes, we need that, because if we have safe places and safe spaces for kids, and one of the touched and forgotten populations of our school system are those kids who are in foster care and group homes. We don't even really even discuss them at all, and they're the ones with the highest triggers and the highest ones that we often don't even talk about, or they're ignored with that. But definitely, we need more effective communications. And I would even say this: family type of counseling and services that can be made available, or at least resources made available in the schools that they can refer out to as well. I think if we have that partnered with our school teachers, I think we would see much better outcomes in our educational system. We cannot treat it in the way that we have been treating it and expect our kids to do well, because one of the things, I have several students who are high school seniors, about
Mhm.
5 or 6 of them, and I did wellness checks because we're having drive-by graduations. First time they've ever had that, because you figure this is the first class that did not have a prom, did not have all those senior activities that go along with that, or those who are promoting to the next level and the grade level in that as well. So they've had to be, a lot of them, we had to walk through all of that because some of them felt cheated. And what does life look like now for them? And just kind of rewarding them and making a big deal out of graduation, because it's huge. It's supposed to be a monumental event.
Absolutely. I definitely agree. So, Doc, one of the things I want to ask, because we had a lot of testing questions, and some people live here. And so, what do you recommend? How do they find out if they can get tested if they're in the Atlanta area? where can they get tested? Just wanting to provide people, we've told them about insurance, but trying to provide them a place where they can actually get tested.
Yeah, I'm always so amazed that people. It seems to me that if they have a doctor, a primary care doctor, um, you know, they should be able to go to that primary care doctor's office and get tested. Now, if your doctor's office is closed, even though I don't think most primary care doctors' offices are not closed, but that should be your first step. You can go to the health department, but then you have a questionnaire that you have to complete online, because they're still after the people who are with symptoms. CVS, you can also go on the CVS portal and complete a questionnaire there, and then get an appointment and do their drive-by testing. But there's plenty of places to get tested. This should not be such a difficult thing in terms of getting tests. All you did was just call me up and I say, come on in, let's get tested. It shouldn't be that hard. And it amazes me how many people are like, oh, what, you got the test? I'm like, yes, we have the test. I ordered it and it came in, and then, we've been testing people.
Yeah, I think, you know what, Doc, I think that you and your staff do a really good job of making that known, right?
Mm-hmm.
Of providing your patients with the information. I think what's happened is that we are not getting that. I mean, I called you. I didn't even call my primary care. I don't know if they're open. Like there just wasn't any communications, right? And because I have a relationship with you, it's different. Everybody doesn't have that. But if I'm just the regular person, I don't know if my, and there was nothing out to say. Like, I think some of that shows kind of the breaks in some of our medical system.
Right.
I mean, we have insurance.
Correct.
It's not just
and
people.
Every insurance has to pay for it. Everyone.
So
this is not something that they can deny a payment on.
Right. And so I think
it's a governmental mandate. They have to pay for it.
It's just the communication. I mean, I would like to know how many people got communication from their physicians to say, hey, this is what's going on. Hilton, Marriott, Delta, all the big people they've been keeping you abreast of what's going on.
Mm-hmm.
I think in this time, it would have been nice to have, and I'm not saying no one has it. I'm just saying that I haven't experienced it. It would have been nice to get those same COVID-19 updates, right? To say, hey, right now we're not testing, because at the beginning, no one was getting tested because unless you were symptomatic. Oh, we're opening our offices. I don't even know if they opened or closed, so I think it's just those, and, maybe that's something I work on as a offering, communication plan. But yeah, I think you, so I asked that because I know you and I have that information, but for the regular person, we saw the situation last week where they were like, well, no, we're only testing people who are having surgeries.
Mm-hmm.
That's weird. So, but I appreciate that. So I think the first thing is you guys call your primary care provider.
Most definitely. And
the opportunity.
And even with that, let me jump in with, I have to always put my mental health piece on it.
Yeah.
Every insurance company has approved telemedicine. So that is approved right off the bat for anyone who has insurances and all that. If you've never utilized or accessed your mental health piece, every insurance plan has an approved telemedicine right now, so that you don't have to go into anyone's office. You can do it via telemedicine, and they're all HIPAA compliant and secure and those type of things right there. So this is the best time to access it. Also, you don't have to go into the office. You can do it in the confinements of their homes. And it's been great because people have been able to do their appointments on their lunch break, right after work or at home. And it's been so convenient. So I love it because now the excuse of why you have not been able to go see a therapist really has been and is erased.
Mm-hmm.
Yeah, absolutely. And that's such a great point, Marty, because we've been doing literally probably 25 to 30% of our patients that we see every day now has been through telehealth.
Yes.
And a lot of the insurance companies, not all, they'd have to check, are not charging copays.
Right.
Not charging copays.
Yes.
Or they're paying the copay. They're paying the full office visit versus, the $25, $30, $40 that you'd have to pay. So they just have to check with their insurance and see if they have to pay copays or not. But it's there, and every insurance, as you said, is paying for telehealth.
I love that. Thank you, Marty. Thank you for that. Because I think at the beginning, not everyone was paying for it, but I'm glad you provided us with that. So people know that, I always say that there's nothing normal about this, right? There's nothing really normal about it. So if you're struggling mentally with it, then know that there's help out there, and you can, like you said, you don't even have to go into a doctor's office where someone may be afraid. What if they see my car? What if they see you guys, thank you so much for just all the questions. Dr. Christie, who is Naomi? She said, hey, y'all. Hey, girl. How are you?
I don't know. Oh, Naomi. Christie is the last name?
Yes.
Yeah, that's my dad's brother's daughter. So that means that's my cousin.
Hey, Naomi.
Hey, Naomi.
I love it. So Pamela we're going to take this last question and then we're going to wrap up. Approved telemedicine. Will this continue for mental health after pandemic?
I think the trend really is. I have a couple contracts with the County of Riverside, and we are even talking about continuing with this post-pandemic as well, because we have almost a 1% cancellation rate now because you don't have an excuse. You're home. What's your excuse with that? So we're definitely hoping that it definitely has been something that has been talked about, but the pandemic has definitely moved this a lot forward, and it's definitely becoming an acceptable form of therapy with that. And we're finally catching up to the medical field who has been doing telemedicine. So definitely, Pam, teletherapy is definitely on the horizon. And I believe it's here to stay.
Absolutely. And I agree because, telemedicine has been out. I remember when I just got out of residency in the early 90s, we were talking about doing rural telemedicine, and they were developing all these different monitoring systems that patients can have at their home. And now it's perfected. They're smaller. You can do your pulse ox, you can do your blood pressure, you can do your temperature, and everything can just be fed through the screen for the practitioner to have. So it's time. It's been 30 years. So at this point, they need to go ahead, and it's going to be here forever. So I wouldn't worry about it. I would just continue. It's going to be here. It's going to be here. The convenience, you can't beat the convenience.
Absolutely.
Right. And now you get to even have more choices because it's telemedicine, because it's teletherapy. You have more choices in picking those who look like you, who maybe have a more stronger understanding of your culture, your trauma, or whatever you might be going through.
Yeah, I love that. Well, you guys, this was an amazing conversation. If you guys enjoyed the conversation, make sure you put hello, darling. That's the way that we say that. If we said something that was good to you, you say hello, darling. Let us know. I have a dentist surgery next week. I'm so glad to know that I can ask my doctor about his staff. I just want to be safe. Yes, absolutely. So you guys, thank you so much for listening. Doc, Marty, thank you so much for joining. Doc, as always, how can people get in touch with you? I think I'm bringing you some business, Doc, through this show. Everybody wants to get tested, but let us know, how can we keep in touch with you?
Well, yeah, it's N1 Regenerative Center, and that's the phone number there. You have to call, and if you want to get tested, it's a good number to call. The exact extension, it's not written there, but it's 110, and we can email you the information that you need, the registration stuff. You fill it out, and then, we'll get you on the schedule and get you tested.
Excellent. Thank you so much, Doc. I appreciate you joining.
My pleasure.
So Marty, thank you so much. How can we keep in touch with you?
Yes, definitely. My website is definitely marcelconsulting.com. You see it right there. You can also find me on Mental Health Matters with Marty on Facebook, and also Instagram and YouTube, and somewhere out there on Twitter. We're getting that. Yes. And then also you can join us on our podcast channels that's launching this week as well. So excited that Miss Portia is helping us out with that. So I'll be on all your mainstream podcasts, whatever you stream your podcast through. Mental Health Matters with Marty. Oh, look at that. You guys are so professional. Mental Health Matters with Marty on your local podcast, Spotify, Apple, and the whole plethora. Google, you name it. So we'd love for you two guys to join in and hear some more what we have to talk about mental health, because it really does matter.
It does.
Absolutely. We are so incredibly excited about Mental Health Matters with Marty. Portia Scott Media is supporting this, and he's the first podcaster to be up under our brand. So we're extremely excited. So listen. The episodes will be live on Wednesday, but I don't want you to stop there. On Friday, May 22nd at 7 o'clock Pacific time, 10 o'clock Eastern time, we are having a virtual launch party. Listen, you don't want to miss this. We have a musician coming in. Yes, we're going to have some fun. Marty's going to do an interview about his podcast. You guys, it is going to be amazing, and we want you to be there. So go follow Marty at Mental Health Matters with Marty or Martinez Sellers, because we don't want you guys to miss out on what we're going to do on Friday. It's going to be his launch party. We're going to have tons of fun, and we want to see you there. So Ayana, you're next. Yes. Come on. What'd you say, Marty?
Yeah, I'm going to show them to you on Friday live.
It's always a fun time with him. But you guys, thank you so much. Thank you for joining and for being here. You guys, listen, we put that survey in the comments. I want you to go right after this show. Go click on that survey. It'll take you less than a minute to answer those questions. We want to be able to serve you better. We want to be able to bring you the content that you want to see, that you want to hear. And so we're so excited. We just have a plethora of these experts. And I mean, every week it is just more and more exciting. So go take the survey. Let us know, one, how has this just been amazing for you? What have you learned? What do you want to learn? What do you want to hear? And so we want to hear all of that feedback. So I appreciate it so much. You guys, we are going to, Doc Christie, I was schooling and referring your education. Keep it coming. Keep it coming. Keep all your good stuff coming, Doc. You guys know every single week, Monday through Friday, we are here with the Wake Up and Show Up Live. It is your daily dose of inspiration and empowerment. And so we want to see you here. We are here at 12 p.m. Eastern Time, Monday through Friday. You guys know we end every single episode with this declaration. Waking up is automatic. Showing up is intentional. Today, I will show up. We'll see you next time, next week. Same bat time, same bat channel.